So it is 5 o'clock and I'm finally leaving clinical. Today I was in the ICU. It's a step down unit from the ICU. So you have like 3 patients and they all like just came from the ICU or the emergency room. Yeah, today was cool. I couldn't really show you guys anything like the patients or the meds that I was given because of HIPAA laws and privacy laws. So yeah, but just a quick rundown of my day. I start at 5, around 5, as you saw in the video. I wake up, make my coffee, eat breakfast, get to clinical around 6:15. 6:30 is when we get report. So the night shift nurse will tell the day shift nurse everything that went on during the night, any meds or pumps that are discontinued, anything like that. So then after that, we start with our assessments. We give assessments to our patients. We had 3 patients today. One was like an overdose. One was like having an active heart attack, and the third was he had, what did he have? I forget what he had, but a surgical patient basically. Everyone was pretty low acuity. Nothing was really too hard today. But anyway, you assess your patients, you see how everything is doing, like you check their baseline blood pressure, baseline heart rate, to see what you're working with for the rest of the day. After that, you pass morning meds. So we passed our morning meds. People didn't really have too many meds this morning, which was great. Like, I had a really chill day. My last day has been amazing. All of my patients were cool. They were chill. They weren't pooping on themselves. Like, it was great. It was a great last day. Around noon, we have lunch and we all meet up for post-conference. Post-conference is where all the nursing students, there's about 8 of us, I think, we all come together in a conference room and we talk about our patients and like the things we got to do, stuff like that. I didn't really get to do anything cool today, but your clinical experience in the ICU can range from a day like mine where I just kind of chilled out today, all my patients were kind of stable, or you can be in the ICU where people are coding and you're doing CPR, or you can be in the emergency room where it's just, you never know what you're going to get in the emergency room, from kids jumping out of cars because they're scared of their parents, to gunshot wounds, stab wounds. You literally never. After post-conference, we go back to the floor and just continue to pass meds, continue to take vitals, check assessments, and take our patients wherever they might need to go. Like, they might need certain procedures, like stents placed or like a CT scan. It's the nurse's responsibility to take the patient if they're on a heart monitor, because if something happens to your patient and, like, let's say a tech took them down, it will be your responsibility to like start CPR. Anything like that could happen. So for these critical patients, the nurse has to stay with the patient at all times. You can't like pass your patient on to like someone who's not a nurse. So, this critical care clinical has been crazy. It's been fun. Definitely a learning experience. I learned so much. I learned how to put an IV in my clinical, my critical care clinical, in the emergency room, actually, under pressure. They're like, okay, put in an IV, like, we need an IV. I'm like, I never even put in an IV, what? But it's fast-paced, like, they teach you right then and there. There's no, I think I can do it, I don't know. No, they're gonna put you right in. And that's what I really loved about this clinical. But anyway, yeah, if you guys have any questions about my critical care experience, comment down below, subscribe, and I will definitely get back to you. Thank you.